obviously I still have the stricture. I still have severe inflammation where I've always had it here in my descending colon. That has not really changed at all.
So we can put the ostomy in 4 places: lower quadrant, upper quadrant. What I'm saying is this is the lower part that you're having operated on. If he does it up here and he doesn't move the splenic flexure down, or the splenic flexure down, he may not be able to reach it to there.
Gotcha.
Does that make sense?
Yeah.
So we are done, and this is what Paul got. Stoma site.
1 and 2.
Wow, you can't remove it at all until your surgery, huh? Everyone. I'm tired. So much is going on. It is the morning. Sushi here has woken us up. Right, baby Sushi? Don't grab mommy's phone. Don't grab mommy's phone. Let's continue. Yep. She's like taking the phone. Sushi, don't take the phone. So she stopped the recording. She's so smart. She's looking at the phone like, give it to me. She's reaching out for it. Oh my gosh. Because I'm not giving her the phone, guys. Like, that's one of our biggest rules. We don't really give her phone, because once you do, she just starts throwing her mini temper tantrum so quick. She wants a phone. And Paul's parents are like ready to buy her own phone, which is not okay. My mom always just gives her phone. Like, oh, she could just take it home. Like, grandparents, quit it. We're gonna go get ready. We have a doctor's appointment. I'm exhausted. This week has been crazy, stressful, emotional, physical, mental, because on Friday, Paul is getting his surgery. So today's appointment is a doozy. So let me get ready. I need to take a shower, brush my teeth, because help get this one ready. Oh yeah. And then we head out, and I will tell you guys what's going on. But today's vlog does have something to do with Paul's surgery day. So let's get this day started and let's get going. Right, Sushi? Yeah, with your little feetsies. And I am done. You guys like my look? I tried my hair. Well, whatever, I don't care. Got Sushi's shoes. She is not having it today. We think she's teething really badly. So she's just miserable. I have breastfed her like maybe 4 times already today, and every single time she has bitten me. I have a little PTSD every time now I feed her. I'm like, I don't want to, she's gonna hurt me. So the last time though, when I did feed her, she was already starting to bite down. I was like, that hurts mommy. And she loosened her grip, so I think she understood. But then she did it 2 more times, so you guys get it. So now we are on our way. We'll talk to you guys in the car. We are driving to our appointment right now. I keep saying our, but this is all Paul. This is all Paul.
So we are going to go see a ostomy nurse. Reason why is because obviously I'm going to be having surgery and I'm going to have a colostomy now. The nurse is going to go over some information with us, and the biggest thing is going to do the placement. Now, it's kind of weird because you're probably thinking, shouldn't the surgeon be the one that's going to determine where it goes? Yes, but at the same time, the nurse, they have different expertise and training where they can, see, hey, for your body type, for your situation, it'll best be placed right around here.
Yeah.
You know what I mean? And then her recommendation goes to the surgeon, and the surgeon does the work. So, it's a team effort here. That's the most important thing. So, today we're going to go. She's, asked me a few questions, go over some information. I have questions for her about having a stoma and, this craziness part of my life that I have to have a colostomy bag now. And then, strip and show her my cheek chest.
That's another update, guys. Paul did see a surgeon last week, I believe, right?
Yes.
And the MRI that you guys saw us doing previously it got to him, and he gave us the results. Paul, what were the results?
So, very, very good news.
It was.
Obviously, I still have the stricture. I still have severe inflammation where I've always had it here in my descending colon. That has not really changed at all. So his theory is that it has now turned into scar tissue. It's no longer inflammation. Nothing can be done. It has to be removed. But the vast majority of my colon, he's like over 60%, maybe 70% of your colon is perfectly normal. It looks fine. So my colon is pretty much normal in about 70% of it. No wall thickening, no inflammation. Everything looks really, really good. So he said this is an amazing thing because now I don't think we have to remove your entire colon. I can just remove the problem area and then give you a colostomy. So what this is going to do is allow my rectum time to heal. So that any kind of inflammation I have in there, my fistula, the fissures, all this stuff can all calm down and pretty much heal. I would have the colostomy, and then later I would have to have another surgery to then reconnect what's left of my colon back to my rectum. So this is amazing because then it's not going to be as bad as what it was before. I will be able to have a pretty much almost normal bowel functions and less complications of just having your small intestine, because remember, your colon absorbs water. So when you don't have your colon, you get dehydrated really, really fast. So yeah, this is overall absolutely amazing news.
I get
Better
it.
than having my entire colon removed, because then the recovery time is less.
Yeah, it is.
The surgery is shorter. It's only about 3 hours versus 6.
Yeah.
So, you know, overall, it's less trauma to the body, less time that I have to recover, basically. Which is good because I don't want to be in bed for 12 weeks not doing anything.
Yeah. So now we are off to this appointment. I don't know what to expect. Like, well, I don't even know where to even start any of this, but we're going to take you guys along for this journey and let's educate one another, shall we?
Ostomy, correct?
Incorrect.
Incorrect. Oh, what's
So I said that reviewing some of my CT scans and my most recent MRI, that he's just going to do a colectomy and give me a colostomy.
Oh.
Yes. So that, because like he said, from my descending colon here is where the worst inflammation is. But he's like, from here, all the transverse, the ascending, everything looks normal. So he's like, I want to try doing this, giving a colostomy, let the rectum heal everything, and then reconnect it later.
Oh, okay. Have you done any research on your own?
A little bit.
Okay. So, what is your thoughts so far?
Terrifying.
Terrifying.
For me, as a caretaker. Terrifying.
Yeah.
You know, I need it. What am I going to do about it? You know, this is hopefully temporary.
Yeah.
And get to a better place.
But I'll tell you, having done this a long time, that the whole population of people that I care for, people that have cancers and all that, you know, they typically are asymptomatic. They don't have many problems. They have, I have a cancer and I have to have what done, you know, then that kind of thing. But inflammatory bowel disease, whether it's UC or Crohn's, because you've been sick or you've been miserable, sometimes it's actually a relief that you're going to feel good.
Yep.
If you can get over the body image and the function change, it's all here. It's all really there. If you can just keep a good attitude about it, and I always tell my patients that you don't ever have to like it. You have to understand what it's doing for you. And that's that it's helping get you where you need to be healthier.
I used to weigh around 235, and I weigh around 184 now. And that has all happened in about 3-4 months.
Yeah.
And I'm spiraling out of control. I had a fistula, a horrific pain, and I'm just like...
I read some of that. And
I'm just like, I can't
Crohn's
deal
is
with
just a bad disease. It just is overall. It's so unpredictable. And, you know, I have patients have had minimal disease, and I have some that have very serious disease, and I have friends that have it and have hardly any problem. But it can flare up at any time. That's what the challenge always is with it. So we can put the ostomy in 4 places: lower quadrant, upper quadrant. What I'm saying is this is the lower part that you're having operated on. If he does it up here and he doesn't move the splenic flexure down, or the splenic flexure down, he may not be able to reach it to there.
Gotcha.
Does that make sense?
Yeah.
So we may have to mark 2 sites. You're a little bit hairy there.
A little bit.
But you can shave around it too. You can shave underneath where the pouch systems go, and I'll show that to you, because the hair will interfere with your seal.
Yeah.
So
laser hair removal it is.
they can look differently. They can be budded. They can be they can be well budded. They can be slightly budded. They can be flush, and sometimes they can even be retracted. It all depends on how surgery goes and how easy it was to bring your bowel up. You probably got some scarring in there and some stuff going on just from your Crohn's. So sometimes that complicates things. Things kind of get matted in there and stuff. So depending on that depends what the stoma will look like. Mucousy, and it's going to be moist and wet. So just every time you look at it and you're afraid to touch it, think about it. It's like touching the inside of my mouth. It's okay.
Okay.
Think about that. Because it is. It's the same thing. It's just redder. Okay. Now, it also is very vascular. It's why it's more red than pink in our mouth. And sometimes when you clean around it, you might see a little bit of blood that will come on what you're washing with. But that's okay too. It's just not used to being, remember, this is the inside of the bowel. It's not used to being touched.
Yeah.
So, and people say, well, does it get better? Well, it just depends on the person. Most people don't get much blood at all, but sometimes some medications you're on that might make your blood a little bit more susceptible to it. You know, people that take like an aspirin or a blood thinner or anything like that, it's going to be more likely to do that. But again, we're not talking about trickling blood. We're just talking about a little bit that's on there. But that's one of the most common questions or a phone call that I get. Oh my God, my stoma's bleeding. Okay, well, how much is it bleeding? You know, usually it's a dot. You know, that's nothing to worry about.
Gotcha.
If it's freely flowing, yes, that's time.
Go to the
that's not
hospital.
normal. Yeah. So it's going to be swollen at surgery, and so it's going to shrink down. So let's say your bowel is pretty swollen right now. I don't know if it is, but let's say it is. And then he does surgery, it's going to swell. So maybe it's going to be kind of big when you come out of surgery. And then it's going to shrink down. It's about like, this might be as big as it would be. Okay, this one. Okay?
Okay.
And then it would maybe start going down to 1 3/8, might get as 1 1/4, and sometimes it can be smaller.
Okay.
You know, so it just depends. Now, let's say it ends up being 1 3/4. Don't panic. It just means your bowel was swollen. It's going to come on down. It has absolutely no feeling to it. So when you touch the stomach, that's the weird part. You touch it and you think, okay, that's me, but I can't tell you that's me. So that's kind of weird. So if you get any pain, it's going to be where the stoma meets the skin or around on the skin, like maybe if it got irritated or
So
something.
not the stoma itself, just like around
It. Yeah. So if you're cleaning around it and you feel something, go look at that area, because maybe it's a little irritation that you didn't see, but it's there. Okay. Now, the big difference between ileostomies and colostomies, and like I said, the care of it's pretty much the same. They kind of look similar. One's large bowel, so usually a little bit larger than the small bowel. But what's different is the output. So in ileostomy, it's small bowel contents, so nothing's gotten absorbed. So it's going to be 5 to 6 times a day emptying. That's normal. Okay.
Wow.
Sometimes in the beginning it's more. Well, it sounds like a lot, but think about how often you go to the bathroom to urinate. It's about the same.
Gotcha.
Okay. So what most people do, if you have an ileostomy or a colostomy, you go to the bathroom. You're going to go less with the colostomy. You might start out 3 or 4 right after surgery, and then we'll hopefully get down to just a couple times a day. So the advantages of a colostomy are they usually go less, and they're usually less irritating to the skin, but it still can get irritated. So this is my well-loved stoma. Plastic stoma.
Oh.
Okay. So remember, we want to protect the skin. So your first stool is going to be liquid. So we're going to protect you with additional barrier. Over time, if you have a nice bedded stoma, we probably can get away with not using this anymore. They're going to teach it to you in the hospital, and we'll probably stay with it until your stoma shrinks to the final size, which will be those first 2 months. So this is like Play-Doh. Okay, yeah, it's just sticky. I feel it's kind of sticky.
Oh, yeah.
And it won't hurt the stoma, and it needs to totally protect what's right around it. So you just stretch it to the size of the stoma, and you just put it around it. Let's say I went like that, and there's skin showing right there. You can either pick it up or just push it in. You just want to make sure that it's touching the stoma, because now when the poop comes out, it's not getting underneath there, and it helps it to get a really good seal. Okay. This is a 2-piece. There's also 1 piece. Usually with colostomies, I like 2 pieces because you have options of popping on different things. We try to make it easy after surgery. So this is one reason why we like to put this, is that this is moldable. So all you have to do is roll it out. You don't have to cut it. You don't look too bad. Okay, go ahead and lay down for me. I forget, you're younger. Oh, sorry. Is that your hair?
No, just the pressure pushing on there.
So you're hurt. So that area is real painful. Oh gosh.
Oh yeah.
Let me know if I hit you. Okay.
No, you're fine. Just like pushing that. Yeah, it hurts, but
I'm gonna try not to hurt you, but put your legs both up off the bed at the same time. Can you do? Nope. Like this. Yeah. Nope. Down a little bit. I just need to feel your rectus muscle. Am I hurting you? No, right there. Okay. You can relax. So I'm gonna just show you kind of where. I'm going to be putting these little markers on you. But, okay, your rectus muscle's right here. Look, right in line with your nipple. Okay? So this is your rib cage. So I've got to avoid those 2 sites, right? So my ideal location would be about right here for you. But I don't know yet till you sit up. But I'm going to also put one a little higher in case you can't reach it. Okay? So you're not going to like this with your hair.
of course not.
But I'm going to put them on lightly just to see if I can see how it looks on you. Okay? Because I need this part more than I do the tape part. So maybe I won't put the tape on you. So I'm just going to try to see, because this is my point of playing around.
That's fine.
Trying to see what's going to work the best on you. I'm just going to play with these. I'm not going to put the adhesive on it.
Just rip it off, get the waxing done early, you know.
Well, maybe I'll do half of it just to hold it down. It's not going to stick too much to your hairs anyway, so. And you'll be shaved after surgery, so.
Yeah. I remember after my appendix surgery, they shaved my entire belly and left one little chunk here. I was like, come on, man, you couldn't just finish it off?
Like a soul patch.
Oh, that's pretty funny. Okay, now turn around. Now it's going to look kind of weird because I got 2 of them on you, but I can really see what you. So let me see where your rib cage is. So it's a little higher for you on with your pants. Okay.
Mm-hmm.
Nothing's not right on you.
It's perfect for you.
Yeah. Okay. So can you see that size?
Yeah.
So if the stoma was this big, you'd be able to see that.
Mm-hmm.
Okay.
Not that bad.
So which do you prefer?
So in your experience,
Well,
what would you think is best?
Well,
would
I
you
will tell you, if
recommend?
it were me, I would go lower if I had a choice.
Okay.
And the only reason it's easier to reach the commode. Think about that.
Makes sense because you can just sit in the
Yeah,
little pouch
yes.
and there you go.
Yeah.
Okay, that makes sense.
Let me get we may not have a choice in that.
Yeah, that makes
Sorry.
sense.
If it's like that, now when you lean forward a little bit. See, you can easily do it. Let's
Yeah,
see how
that
well we
makes
do
sense.
it here. If it's up here, you can still do it. It's just a little longer reach.
Mm-hmm.
So, but it's really up to you. I mean, you'll see this one better.
I have a feeling I like the lower because it makes more sense now.
Like cutting with the weed whacker.
Shut up. I
I'm sorry.
Believe me, I have men much worse.
Really?
Oh, yes.
was gonna say, how often do you change?
Well,
Every
some
3
people,
days, 5
you,
days?
oh yes, I didn't go over that with you. So usually pouching systems are changed twice a week,
Okay.
at least initially. And then with a colostomy, you might be able to wear it a little longer. But quite honestly, insurance is going to pay for 20 wafers and 20 pouches a month. That's enough for every other day. So why would you want to wear it longer is the way I look at it. And most people want to kind of get changed to be just a little cleaner with it, you know.
Yeah, that makes sense.
So,
Like if you have to, cool. But if you don't have to,
Yeah. And it just depends on what you're comfortable with. You won't know until you're working with it.
Yeah.
And then you'll say, you know what? Or we're getting ready to get into summer. You might want to be swimming, and you might want to change more often. You can swim. You can do all that with these. Oh, sorry, that's where it hurts. Okay, let me just do lightly here. I don't want to hurt you. So you really hurt me.
Oh yeah, there you go.
Like I can't lay on that side like face down or anything.
You're gonna feel like $1 million after this.
Oh, no, that's what my GI doctor said. He was like, the quality of life that you're living is not normal.
And that's what I'm saying. Of all the people, even though you won't like the ostomy necessarily, it will give you at least. It'll make you feel your life will be so much better quality.
That's how I look at it.
Yeah.
Like, if I have to do it, I'm gonna have to do it. So
Right.
let me do it. Feel better.
Yes,
And
then
that from there is great because I need to take care of my daughter too.
So we are done, and this is what Paul got. Stoma site.
1 and 2.
Wow, you can't remove it at all until your surgery, huh? So today's appointment went pretty well. It was, for me, just very overwhelming. But we were in there for like 45 minutes. It was a long appointment, very detailed, right? I want to say more than that, but I'm trying to like underwhelm the appointment time a little. But it was very detailed, informative, like, you know, she answered all our questions. And of course, Paul, looking up, doing his research, he was very well versed on everything and had a pretty good understanding. So Paul, how did you like today's appointment? How are you feeling? How does the little sticky stuff feel on your belly?
It's fine. This is a very weird journey to be on.
It is.
Sure.
It is.
But at the end of the day, my ideology from all this is going to get me feeling a lot better.
Yeah.
Which is what I need. The life that I am living, the surgeon, my GI doctor said, like, you've gotten used to it. This is not normal. This is not normal for you to live and be this way. And I don't want to be this way. I want to be happy. I want to be healthy. I want to work out. I want to be able to, you know, play with my daughter, take care of her, do everything that I need to do as a responsible father and parent and husband.
Yeah.
And that's just the thing. The way with my Crohn's right now, I can't. So that's why I'm taking this head on. Can't do nothing about it. I need it. I need it. That's it. I'd rather just get it done.
It's going to give you a better quality of life.
Exactly. Get it done and over with, on the road to recovery. And then they said it, the ostomy nurse has said it, the surgeon has said it, the GI doctor said it, and I've seen videos and other people and like support groups say, like, after this surgery, you feel so much better with your Crohn's or your UC, whatever it may be. That like you feel better, which is a good thing.
So guys, I'm exhausted, a little drained. So I think this is where we're gonna end it. But stay tuned because Paul's surgery is coming up this week. We have what, 3 more days left? Yeah, so that's gonna be a journey in itself. So guys, for now, adieu and goodbye.